Good morning, Dr. Lebowitz at the Long Island Gynecomastia Center. So I got this young man, so he's got an interesting story. He's in his early 20s, and he was accepted to the Navy SEALs. So he's like an amazing kid, been through a lot. He had a car accident, or he was hit by a car when he was 11, and he had some pituitary problems and an aneurysm that we all discovered through really wanting to build up his body. And this is low testosterone, as everybody has. Testosterone levels in males are one half that they were, 10, 20 years ago. So he had gyno surgery about 4 years ago by a local doctor. I revised it and revised the scar. It's perfect. We've been giving him some steroid shots because he's like OCD in kind of his body. And if you look at him, you can tell that his body is absolutely amazing. He works out a lot. Now he's on something to inhibit a pituitary adenoma. He had the aneurysm clipped from a prior accident when he was younger, but he was accepted to the Navy SEALs. He's into his body. His gyno is gone, and he looks great. But what bothers him today, and it's killing me that we're doing it, but something, I know this kid and I trust this guy that he's not gonna, kind of really torment me about this and about that. And plus, if he comes in once a week, once a month, I love when he comes here, so it doesn't matter. We go out for lunch and we have fun, but the nipples are bothering him. And people, if you zoom in on that, people are gonna give me shit, give him shit. What are you talking about? This and that. He's crazy. I'm crazy for doing it. Well, yeah, I'm crazy and he's crazy. It's all right. Let's face it. We're both crazy. But if it bothers him, he wakes up every morning and he thinks about it. He wears a t-shirt and he thinks about it and he obsesses about it. Then what the fook? Let's just do it. Little incision. It's under local. There's no risk. Little incision, my sombrero Mexican hat thing, and I'm gonna make this down really flat, knowing that a little bit of scar tissue will form and a little bit of scar tissue will make it bumped up. And again, if it's bumped up too much, he knows my phone number, my cell phone number by heart. He comes, "Doc, can I come in for a steroid shot at Kennelock 10? No problem, come in." But if it bothers him and it's no effort to do it, well, I love him, he loves me, we'll just do it. I mean, really, it's just get it done so that you don't obsess about it. And life is too important to be obsessive and worry and fear. And, just live your life and be happy. And he's great. I mean, Navy SEALs. I mean, really, give me a break. This kid is great. Look at the muscle definition. He looks amazing. So, local anesthesia, bilateral nipple reduction. Let's do it. So he wants it smaller in the diameter and less. So, yes. So we cut around the base of it. So this is a little cautery. It does two things. Stops a little bit of capillaries, and also will dehydrate some of the stuff so I can really make it perfect. Dr. Lebowitz, Long Island Gynecomastia Center. So this young man, great shape, great kid, amazing young man, Navy SEAL material, who had gynecomastia, not by me, 4 years ago, by a local guy in New York, a very good plastic surgeon actually, but it just wasn't up to his standards and my standards, and he's OCD about his body and his actions. So I revised it and also revised his scar tissue a little bit, the incision that was a little bit off. We were over the past 3 years doing some steroid shots to make it perfect, because he was again wanted no protrusion through his shirt. And lastly, he came back to me a couple of months ago saying, "Doc, everything's great. just my nipples. I go, you're crazy. I go, no, I'm not. I said, yes, you are, but I'm crazy too, and let's reduce the nipple. So he wanted really almost flat, just a hint of a nipple right in the center. So these little strings are my sutures, local anesthesia. Got it to perfection. I guarantee my work. So he has to be happy. And he will be. So local anesthesia, the immediate results. And since I didn't go into the gland much, you know, I'm going to give him the vest. He's going to wear it for whatever, a couple of weeks. He can work out pretty soon, a couple of days. He's local, so I'm going to monitor him. He'll come in, see me on a Saturday or Sunday, which he always does. We go out for breakfast, protein only, no carbs, and we have fun. You got to have fun in life. Why not? So if you have gynecomastia, if you've got puffy nipples, if you got big nipples, if you're crazy like me, you call me, Dr. Lebowitz, 631-424-0101, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. And everybody's thinking, what are these hickeys on the back of my neck? I had cupping last night because I'm a warrior too, but I'm not 21, or 22. You know, so cupping is great. Look it up. What is it? C-U-P-P-I-N-G? C-U-P-I-N-G?
It is.
C-U-P-P-I-N-G? It's cupping, and it does this. This will go away in a couple days. So anyway, Dr. Lebowitz, gynecomastia, you need me, you call me. Thanks. Bye.